Welcome everyone, Dr. Linder here. Okay, in a previous lecture and video, we talked about epithelial tissue, right? We're still talking about four types of tissues: epithelium, connective, muscle, and nerve. In a previous video, you can find epithelium. Now we're looking at connective tissue. If we think back to epithelial is when we had cells that were closely packed together with very little extracellular matrix, which is in contrast to connective tissue. Connective tissue is when we have widely spaced cells that are separated by protein fibers and ground substance. When we combine the ground substance with the protein fibers, we refer to that as extracellular matrix, ECM, and it's a very, very important part of connective tissue. Connective tissue is the most abundant and the most variable type of tissue that we find. It's in all parts of the body. It connects organs to each other, and it even connects to epithelium. It gives us support and protection. It's part of the immune system, believe it or not, connective tissue, because of white blood cells. So blood is connective tissue. Blood is connective tissue. It's just considered liquid connective tissue. And remember, with blood, we have red blood cells and white blood cells. And we did the differentiation in another video. When you review blood, you'll see the red blood cells or erythrocytes. And then we'll look at the white blood cells, which had granular sites and agranular sites. The granular sites were basophils, eosinophils, and neutrophils. And the agranular sites were the lymphocytes and monocytes. When we think of connective tissue, it is involved with the storage of energy and heat production because of fat cells. Adipose or adipocytes are fat cells. And fat cells store energy. They store them in the form of triglycerides, TG, triglycerides, and they also help insulate us and produce heat. Connective tissue is important for the movement and transport of materials throughout the body. And again, blood is the medium in which things are transported. When we look at connective tissue, we have a few categories. We have one category is connective tissue proper. And under connective tissue proper, we have dense connective tissue, and we have loose connective tissue. So connective tissue proper, we have loose connective tissue, and then we have dense connective tissue. So we'll talk about those two. Then we have fluid connective tissue, which is where blood and lymph fall under. And then we have supporting connective tissue, which is cartilage and bone. And when we spoke about bone, we focused on the osteon or compact bone. And we went over a bunch of these terms in a previous video. And then we'll get into muscle tissue, which is the third type of tissue. And then we'll finish with nerve. Okay. So now let's look back at connective tissue proper, loose connective tissue. And there's three types that fall under that: areolar, adipose, and reticular. In another video, I'll go over how we differentiate these under a microscope, because you will have to identify these. And of the three, I want you to focus a little bit more on adipose connective tissue. And that's because it's very similar to squamous cells in its appearance. I don't want you to confuse squamous cells with a fat cell. A big difference is when you're looking at a squamous cell that looks like this, the nucleus is in the center, but in an adipose cell, it kind of looks the same, irregular, but the nucleus is in the periphery. So this is an adipose cell, and this is a squamous cell. Big difference. Areolar is important, though. It is the padding that we find deep to the skin, and it separates the skin from the muscle. So when you pinch your skin, you can grab part of the areolar, but then the muscle tissue, the muscle slides underneath. And it's made up of some protein called elastin and collagen. These are two really important types of protein. Adipose is unique. Adipose, it has some important functions. It stores toxins. That's an important function of fat, to store toxins. And it's important to manage the amount of fat cells that you have, especially just prior to puberty. The more fat cells you have at the time that you reach puberty, the more fat cells one has that needs to be managed for the rest of the person's life. And fat cells can increase in size and decrease in size. They can hypertrophy or atrophy. Reticular cells are part of the framework of your organs. Now, that was loose connective tissue. Now we're looking at dense connective tissue proper. And dense connective tissue, dense regular versus dense irregular. Dense regular is where your tendons and ligaments are made up of. So tendons and ligaments have collagen that are closely packed together. So if we have collagen fibers that are tightly interwoven like this in the same direction, nice and parallel to one another, that's going to make up your tendons and your ligaments. Okay, that's dense regular. Now, dense irregular is also made of collagen, but they're not tightly interwoven. They can actually, those collagen fibers can be in many different directions like this. So you'll have maybe dense irregular in your eyeball. So you can rub your eyeball and rub it, not just left to right, but left, right, up, down, diagonals, and it doesn't distort those tissues or damages them. That's because the direction of these irregular fibers, the collagen fibers, are arranged in so many different directions, not so tightly packed in regular. So in irregular, they're in different directions. You'll also find it in the skin, but in the dermis, and that's why you can be massaged and your skin can be manipulated in various directions, not just in one direction or the other. Elastic connective tissue, there's the word elastic. We're going to find them in certain ligaments and in higher amounts in ligaments that we find around the vertebral column. And that's because your spinal column is very flexible. So remember, ligaments go from bone to bone, whereas tendons go from muscle to bone. So they're different. When you go from a muscle to a bone, that's a tendon. When you're going bone to bone, that's a ligament. So the spinal column is one bone stacked on top of another. You just have 24 freely movable vertebrae. So those ligaments are going to have elastic cartilage and elastic ligaments that attach there to allow for that flexibility. If we're talking about ligaments of the knee, for example, the knee is very flexible, but it's very unstable. The knee really has poor bony support, so it will have some elastic connective tissue, but it's going to have much more collagen for strength and stability, for more strength and stability. We spoke about blood. Remember, erythrocytes or red blood cells, they're going to carry gases like oxygen, carbon dioxide, and even nitric oxide. Nitric oxide is a dilator to blood vessels. So if this is a cross section of a blood vessel and it's constricted, once NO impacts it, the blood vessel becomes dilated like this. It allows more blood to flow through a dilated blood vessel than in here where it's constricted versus dilated. White blood cells, these are our leukocytes. They help us fight infections. Remember, we had granular sites and agranular sites. And then we had platelets, and platelets help us clot, so they stop bleeding. So blood is really important, and lymph, you'll go over lymph when you cover the cardiovascular system in AMP2, but lymph is the fluid that you find between the cells. It's sometimes referred to as interstitial fluid, and the lymph is going to enter what we call lymph vessels throughout the body. Supporting connective tissue, we have cartilage. Cartilage is usually avascular, has a poor blood supply. And the three types of cartilage is hyaline, elastic, and fibrocartilage. Fibrocartilage is the strongest cartilage in the body. It's a shock absorber. So when we think of fibrocartilage, we think of the intervertebral discs, right? The discs between each vertebrae. We also think of the pubic symphysis between the two pubic bones. Hyaline cartilage is what most of the cartilages that we find in our joints. It covers the ends of the bone surfaces to form a movable joint. So between your finger joints, between your elbow, between your shoulder joint, between your ankle, between the hip, we're going to have hyaline cartilage. And this is the cartilage that can degenerate or break down. And when it degenerates, we call it degenerative joint disease, or we call it osteoarthritis. That's the wear and tear type of arthritis, wear and tear. Very different than rheumatoid arthritis. Rheumatoid arthritis is a systemic disease. It can actually affect not just the joints, but other organs as well, systemically throughout the body. Elastic cartilage allows for flexibility. Elastic, right? It sounds like a rubber band. It's elastic. So we'll find elastic in certain parts of the body, like in the ear, the helix of the ear. We can find it in the nose. We can find it in the epiglottis, in the back of the throat, things that can alter in shape, but can rebound back. Under connective tissue, we spoke about bone. So make sure you review that video on the bone histology where we spoke about the osteon. We mentioned osteoblasts, which are the immature cells that form the bone or the matrix. We spoke about the osteocyte. That's a mature cell that helps to maintain the bone. We spoke about osteoclasts that break down the bone. We showed you on the model the difference between concentric lamellae, circumferential lamellae, and interstitial lamellae. We also went over the canaliculi, which are those spider-like legs that come off of the lacunae. We went over the Volkmann's canal or the central canal. We went over the lacunae or the cavity that houses the osteocyte. We went over the outer layer of bone called the periosteum, the inner layer of bone called the endosteum. And this is one of the pictures that we covered in that video from a week or so ago. So this is compact bone, which is where the osteons are. Here's the central canal. This is just one osteon right here, which has many concentric lamellae going around it. The circumferential lamellae are around the periphery next to the periosteum. Then where we have spongy bone on the inside, that's where we have the endosteum. Okay. Connective tissue, for the most part, is vascular, except for cartilage, tendons, and ligaments. They have a poor blood supply.